Good afternoon, everyone, and welcome to the AgrAbility National Training Workshop Encore webinars. Today's webinar is Let's Move, Movement and Self-Massage for Longevity and Productivity on the Farm, and a novel approach to pain management for farmers, including pilot study results. So AgrAbility is a USDA-sponsored program that assists farmers, ranchers, and other agricultural workers with disabilities. We do go through the land-grant universities, and currently there are 21 state projects. The National AgrAbility Project is led by Purdue's Breaking New Ground Resource Center, and the partners are Goodwill of the Finger Lakes, Osteoarthritis Action Alliance, AgriSafe Network, Colorado State University, and Washington State University. And you can find more information about AgrAbility on the website agrability.org. So our speakers today are Antonia Tony Small. She is an experienced registered yoga teacher at the 500-hour training level, a Yoga Alliance continuing education provider, the owner of a movement coaching studio, and a small oyster and seaweed farmer in Port Clyde, Maine. Tony has been teaching yoga and fitness to older students for over a decade. She began oyster farming on the side with her husband, John, a fisherman, in 2016. Her work with Fishability began in 2021, which has grown her movement coaching to include fishermen and sea farmers. Brie Weisman's background demonstrates a wide range of diversity. She has a bachelor's of science in outdoor recreation and returned to school to get her master's in occupational therapy at the age of 36. She's been practicing OT for the past 14 years, working in a variety of settings, acute and rehab hospitals, assessment, nursing homes, and continues in home health. In 2018, she was hired by Maine AgrAbility to provide client assessments to Maine farmers, fishermen, and loggers. Through this, she has done outreach by writing monthly articles with a healthcare perspective for a commercial fishing trade journal that reaches 10,000 subscribers, and a Maine logging trade journal to promote improved practices and introduce AgrAbility to readers. During the pandemic, Brie designed a pain tool identifier for farmers to have a better communication, with farmers about pain. When she's not working as an OT, she owns a small farm in Western Maine with registered Icelandic sheep and grows winter greens in her 2 high-hoop greenhouses. She's currently working on studying for the Assistive Technology Professional Exam to become a certified ATP specialist. James Wall was an OT capstone student from University of Southern Maine for Brie and Maine AgrAbility, where he had the opportunity to learn more about the amazing work that they do while conducting a pilot-level research study for Brie's pain tool. Since completing his schooling and receiving his doctorate degree in occupational therapy, James has become a licensed and registered OT and has been working in the outpatient setting, specializing in upper extremity injuries, as well as lower back pain and neck pain. Lastly, he has served in the U.S. Coast Guard, which is what actually brought him to Maine. I am going to stop sharing. And there we go. And turn it over to Brie and James.
Meg's the only one I recognize.
Great. Thank you so much, Tess. So I will screen share. Minimize that. Is the PowerPoint visible for everyone?
It looks
Yes,
good.
it is.
All right, you want to go to the next slide, James?
Yep.
Okay. Personally, Tess, you did a fabulous job, so I feel like I don't really have anything more to add. That's me and my guardian llama Shimmer with some of my Icelandic sheep in the background. James, you have any more to add on your?
No, I think Tess covered just about everything, but there's
I think the one thing that is probably not known is that you are currently doing some University of Southern Maine work for OT students, right?
Yes, I actually am a professor this semester, so just grading away with papers.
Okay. All right, next slide. All right, this is only up because I know that AgrAbilities look a little different from state to state. So just to let you guys just had one since 2006. And we work with the University of Maine Cooperative Extension as our land grant program. And Alpha One, which is our Independent Living Skills Center, is our nonprofit partner. I am one of the independent contractors that are in that green bubble there. Right, currently there are two of us. And then we rely heavily on our advisory council made up of folks in the industry or people supporting the industry. And in 2014, we recognized that for the state of Maine, agriculture includes our fishing and our forestry. So logging and fishing was added to us. Next slide. All right. As we go through these slides, you might see some photos of farmers and actions. This happens to be my husband. And just to help remind people that farming does put your body in interesting positions. He is 6'5". He's very inflexible. So most people know that when you're shearing sheep, you kind of are bent over doing them. But because of his challenges with his flexibility, low back pain, we came up with something that really kind of works for us. So as we go along and you see pictures like this, just kind of take that into consideration. And, you know, we know that farmers have more pain than the average non-farmer and that they work outside in the cold and the heat, which is a stressor. They work for long periods of time in often awkward positions. So we're going to play a video in just a moment, and I think it really does a great job of encapsulating farmers and healthcare. So, yep, go ahead, James.
Perfect.
We got a 68-year-old farmer. He was building a fence and started noticing some back pain. Did his wife make him come in? No, he came by himself. He's alone? Yeah, he was worried, so he came right in. Hey, Peggy, wake up. We got a farmer who came in voluntarily. What else did he say? Well, I asked him to rate his pain on a scale from 1 to 10, and he just said, I'm here, ain't I? What? Yeah, that's all he said. I don't know what that means, though. That's because you're using a pain scale for normal people. You got to use the farmer pain scale. Is he going to be okay? Listen to me carefully. Did he finish the fence? No, he had to stop. Dear God. Peggy, get the crash sack ready. It's going down. What's a crash sack? Well, we had a crash cart, but we had to repurpose it as a hospital bed, so we just stuffed everything into a burlap sack. Hey, Doc, Jim Bob's on the phone. He cut his hand. He thinks it's infected. Hey, I don't have time for this. I got a farmer here who quit chores to seek medical care. Well, he's been using Delilah's antibiotics. She had mastitis last year. He just wants a refill. Is Delilah his wife? No, it's his dairy cow. Can you call Leroy with this? I got a situation over here. I tried. He's in the middle of a root canal. Leroy is the dentist? He's the dentist and the pharmacist. Hey, Peggy, can you tell Texaco Mike to go ahead and gas up the fan boat, please? Is Leroy a pharmacist for humans or animals? Do you think we have 2 pharmacists here? Yeah, go ahead and fax him. It might take him a while to get here. Hey, Doc, Jim Bob called back. He said, never mind. Well, great. What? What's wrong? When a farmer calls asking for help, you got to jump on it right away. If you wait too long, he'll say to hell with it and you'll never hear from him again. Really? Hey, what did Jim Bob say when he called? He said to hell with it.
If you live in Maine and you're replacing your
Excellent. I don't know if it was just on my end, but the last part of the video got a little cut. So I'm hoping that that was relatable for staff working with farmers. You know, we know that it can be a challenge in rural area just to get medical health care, and you know, it's more difficult if you won't even seek it. But looking at motivations, I have to say that COVID-19 provided us some time to work on this. The university decided that they didn't want to have staff go out, even if I was going out as an OT anyway for healthcare to meet with our farmers, even though we could be outside. So trying to figure out how I could still make a difference. As a home health OT, I often use traffic light kind of healthcare programs where, you determine if you're in the green and you're in the yellow and you're in the red. And so what we did was I tried it a couple different ways, making one for shoulders specifically in farm work and one for back. And what I noticed is that both of them was really talking about pain. And that's definitely a difficult discussion. So especially with farming, where farmers tend to normalize their pain. It's just part of the job, and that you just push through it because you got to get the job done. In that traditional pain tools are probably ones that you're familiar with, a scale of 1 to 10, with like 10 being the worst pain you've ever felt. Those are difficult questions to answer as a patient, and they're not actually fun questions for healthcare providers to ask either. And lastly, we try to figure out if we could make something that would kind of remind them to think about their pain, because basically what we're saying is if you're, normalizing your pain and you're pushing through it, at some point it's going to give and you're going to lose productivity as a result. All right, next slide. So this is what we came up with. And it doesn't have the greatest name right now, the pain tool. It sounds like I might be putting people in pain. So I'm going to, in the future, probably call it the pain tool identifier. So if you look to the left, the goal says identify your pain, and you see the green, yellow, and red. So we want our farmers to be in the green. That means they have full mobility and strength, their usual range of motion, they can do their routine task, and they have a healthy mixture of emotions. So that's great. If they're in the yellow and you're talking to a farmer, they may be saying that, yeah, they don't have the same mobility. It's a little worse. They have decreased range of motion. Maybe they're experiencing some weakness or discomfort, but they can still do their chore, but they're altering the way they do their chore, and they're having emotional distress, and they're more difficult to get along with. And then red would be they have pain with and without movement. They have very limited range of motion. They might be experiencing tingling or numbness. That is often pain, but often people don't recognize it as a pain signal. And they have difficulty or inability to do routine tasks or chores. And as a result, they may have a disinterest in their own self-care. They may be experiencing increased emotional distress, problems with sleeping, cognitive changes, and they may be trying to self-medicate through alcohol and drugs. So you would go over to the manage your pain part. So if they're in the green, we're trying to keep them in the green. So we say, hey, continue what you're doing because it's clearly working. But if you, next time you go into your primary care physician, have that conversation with your PCP that what can you do so that you're staying in the green, because we're all getting a little older and you may need to change some of what you're doing. If you're in the yellow, we want you to warm up, stretch, avoid strenuous activity. Tony's going to cover this really well in her presentation. And if you're in the red, yellow is you call AgrAbility. That's a great time to give us a call and reach out. But if you're in the red, please don't reach out to us. You actually need to delegate, delay task, or see your primary care provider as soon as possible. And then there's figures front and back. And what we like in that, thank you, James, is just to remind people, if you're working with unpredictable livestock, you're pushing, pulling, shoveling, lifting, and carrying, and you maintain awkward positions, and you're doing hay, you're shearing sheep, you're harvesting produce, moving machinery, even sitting in a tractor that's vibrating can increase your pain level. So the figures would allow people to mark front and back, put notes and dates on it, bring this actually into your primary care provider. Next slide.
Yep. So this is a little bit about the study design that I was fortunate enough to be able to jump in and kind of look at the pain tool that Brie just showed everyone. So the title of the study, this was my final capstone project in my schooling. The title being Exploring a New Pain Tool for the Maine Commercial Farmers. The team of individuals who were involved in the study include myself, Dr. Tammy Bickmore, Brie, of course, and Dr. Erin McCall. This study design, so every research study takes different levels of rigor. This was a pilot level mixed method study. What this basically means that because this tool has never been researched out, I mean, it's been used with Brie's farmers, but it's never been researched or looked into with quantitative or qualitative data. So we thought using a pilot level research study was most appropriate because it was kind of a starting point for further research. The mixed method component of the study includes the fact that we collected both qualitative or narrative subjective data and quantitative, which is kind of the hard numbers, facts, statistics, and things like that from our sample size. The objective of our study was to kind of look at this tool that Brie showed and created and see if it has an impact on, farmers' ability to better identify, manage, and ultimately prevent either chronic or acute physical pain. The overall goal and objective was just to kind of give these farmers this tool and see what effect that it had. So we wanted to really learn if it helped support these Maine farmers recognize and be more aware of their pain. And we also, as a side note, wanted to learn more about factors and potential barriers that farmers had when it came to seeking appropriate care or even just acknowledging their pain. A little bit of background information. So before going into the research study or collecting data, we wanted to, look at the prevalence, the statistics, what research has already been done, not obviously with the tool that Brie created, but just with farmers in pain and everything that we could just to kind of cover our bases going into our research study. So prevalence-wise, I mean, very unsurprising. Farmers frequently report higher levels of pain. One study found that farmers report pain closer to like a 5 or 6 on that 0 to 10 scale, as opposed to other non-farmers reporting their pain, like office workers, at more like a 1 or 2. One study that just kind of collected a group of farmers and asked them about their pain found that 86% of them experienced lower back pain. So it's very prevalent. There's a lot of statistics in the literature showing how common pain is in the farming population. And as occupational therapists, this was something that Brie and I were both interested in because farming has, a multitude of health benefits, being outside, being active, being healthy, but there's also that other side of the coin of, it's physically taxing. There's long hours, there's awkward working positions and tasks and such. At the agricultural trade show last year, I think it was up in Augusta, we had a table and we actually had the third panel of Brie's pain tool with the 2 front and back portions of the human body. And we asked farmers to identify where their pain was, just kind of in passing, nonchalantly, with a sticky note where red was severe and yellow being moderate, which coincides with the pain tool. As you can see, which also kind of was shown in the literature, a lot of lower back pain, as this is the backside, some neck pain, shoulder, a lot in the knees as well. Sorry, the yellow and white contrast is kind of hard to see, but yeah, so there was a lot of research already done with farmers in pain, but now we wanted to apply the tool that Brie created to it. Perfect.
So just a little bit about the farmers who were involved. We had about 70 farmers that attended or actually were willing to be a part of the research when we did that ag trade show. And the oldest farmer that we had participate was 82 and the youngest was 21. So about 57.6 years for average, which is incredibly close, I believe, if not on the mark for the average age of a Maine farmer. And we were very pleased that the gender breakdown was pretty close as well, where there was 47.2% male, 50% female, 0.8% described as other. I think nationwide, there's 43.7% female farmers to 56.3 males. And then experience farming. Well, our oldest farmer said 80 years. So he started when he was 2, but the shortest was 1 month. So we had about a mean of 21 years. Yep, next slide. And a little bit more, we're looking at, so farming methods was there manual, like 22% if you look at the blue, versus mechanical in the red, and that most of the folks identified, 63.9% used a little bit of both. And then in terms of how many were AgrAbility clients, only 22.2% were AgrAbility clients, so 77.8 were not. And we were looking at a little bit about organic versus non-organic, since organic tends to involve more manual and physical labor, less machines, that might increase pain. Next slide.
And kind of going from what Brie said, we did have 70 people from the trade show who were interested, but just because of, issues following up, time of year, things like that, we ended up having a sample size of, that number seemed to drop down to 36 for our week 1 sample. So we collected data at 3 distinct different time periods, week 1, 4, and 8. Unsurprisingly, that number obviously decreased from week 1. It went from 36 to 35. So we lost 1, and then we lost 5 or 6 total by week 8, which for a pilot study during a busy season with farmers, I mean, it was still at about an 83% retention rate for a study, which we were very happy with. A little bit with our findings. So this is getting kind of right into the data and statistics of kind of the questions we've asked. So how often does pain interfere with your everyday life or work? Below you can see the legend of the different levels. Kind of throughout from week 1 to week 4, it stayed at the sometimes interfere to almost always is interfering range, which really just kind of highlights how much pain is interfering the sample of farmers that we had. The next question we asked was, how often do you push through pain to complete a job or task? Very high numbers again up here, so almost always across the board. It dipped a little bit from week 1 to week 4, but then it shot up just a hair by week 5 or week 8, excuse me. Do you believe that you lose productivity due to your pain issues? So this was very surprising. So kind of almost unanimously at week 1, 97% of our sample said yes. And then as the study progressed up to week 8, that number significantly decreased to 83%. That could be done a factor of them using the tool more, being more aware of their pain and not pushing through the pain, and instead acknowledging it, and as a result not injuring themselves more, so that their productivity might have improved. But another question we asked was, work-related pain negatively impacts my sleep or ability to enjoy my leisure time. So we asked how strongly they either agree or disagree. So surprisingly, there was a huge, almost 4.1 stayed the same at week 1 to week 4, and then it dropped down by 0.3 points, almost to in the middle of that neutral to agree by week 8. Again, it was a small decrease, but it does show lowering of how pain is impacting those, essential activities of daily living when it comes to sleeping and enjoying their leisure time. How many hours of work on your farm per year do you estimate losing to pain? So this gets kind of right to that productivity question and information that we wanted. At week 1, the farmers were estimating that they lose anywhere from 2 to 3 weeks, kind of in this range of productivity or ability to work on their farm. As the study continued, it slightly lowered, closer to that 1 to 2 weeks period, which, I mean, time on the farm for a lot of farmers equates to, money that they're making or livelihood and ability to sustain themselves. So this was a very interesting statistic to find. The next few slides that are going to be showing different things that we collected are more specific to the data tool or the pain tool and their usage of the tool. So we wanted to know how often they use the pain tool. That when we started the study, there was no specific instructions. We gave them how the tool was designed to be used, but they had the complete autonomy to use it as much or as little as they wanted. At week 4, we collected this information. There were 6 farmers who didn't use it at all, as opposed to on the other end of the spectrum, 3 who used it every day. The most common was once a week, with the average being kind of once every 2 to once every week when we averaged all the data together. By week 8, those numbers kind of decreased a little bit too. The farmers, for whatever reasons, used the tool a little bit less, but we still had 2 farmers using it every day, 2 using it every other day, and so forth.
So some of the narrative we got about the pain tool from the farmers, ran the gamut. So if you look in the right-hand corner, this person felt like it didn't tell them anything they didn't already know. And then you got the good, it's helpful to look at the first time, but doesn't need to use it daily, which would be kind of natural. You kind of get used to thinking about, where am I, green, yellow, or red? This person, it was a handy chart for categorizing and giving words to various levels of pain, much better than the 1 to 10 scale used in our hospitals. It helped me focus more specifically on my level of pain and how I could modify tasks to be easier. At the start of the study, I was more aware of the pain tool. Throughout my day, as the season became busier, I thought about it less. So we had even more comments than that, and we could range from, some people felt it was too elementary to use, and some people felt like it was, they liked it because it was easy to use. So we kind of ran the gamut on that. Some people felt that, it was, simple to remember. Some people felt like it was a passive tool. So in the future, kind of taking that information and seeing what we could do with it. Next slide, James.
Yep. So some just final questions. We asked the farmers, how has their ability or awareness to identify their pain changed throughout the study? And this was actually really promising. At week 4, we kind of unanimously either had the same amount of awareness. If not, they were more aware of their pain as a result of using the tool that we provided, with one farmer even being much more, or rating it as being much more aware of their pain. At week 8, we kind of followed the same trend, except for 2 farmers feeling that they were less aware of their pain. But I mean, the much more aware jumped from 1 to 10. So 10 farmers felt that they were much more aware of their pain as a result of using the tool. And then lastly, we asked if they're likely to continue using the tool. So outside of the study, without us collecting data, without us emailing them or following up. And we found out that 2 farmers felt that they were very likely to continue using the tool. The most were likely. And then there were 5 who were very unlikely, 6 who were unlikely, and then 7 who were neutral. And
So, I mean, I feel like, if you're looking at, like, there were 30 folks and you get about 12 to 15 that found this tool somewhat helpful or may potentially be more aware of their pain, that's actually, in my my own personal view, a win. So that means that we have to do more and look at other barriers for farmers seeking appropriate care or acknowledging their pain. Let's go to the next slide, James.
yeah,
So here's where, especially you guys staff, what would help us is if we could try it out with more farmers. Obviously this was in Maine, so we had Maine Farmers a variety of livestock and, crop. No ranches out here really. So that would be helpful. We'll probably be modifying the tool as a result and just getting feedback from you guys. The tool can be found on our website, which is listed below there. We have had interest from other OT students about making it maybe their research project and capstone, because as James said, this was the first initial pilot study. We didn't have a control group, which, is more validating of a study. So we could study it a little bit more. I don't know if you want to flip a couple slides down, James. And I think we had, I'm thinking of study limitations, James. So aside from we had a small number of farmers participate, 30, I was also a screener for the tool, and some people might have recognized that I was a part of that, so that could have influenced people. And it was only 8 weeks. That's not really a very long time in the thick of things. Anything you want to add on that, James?
No, I mean, collection bias too, with, the change of seasons, with farmers, getting more busy. We didn't follow up with the farmers who dropped out of the study, so we don't know why they did or why they didn't. So that would have been something that would have been interesting to look into. And yeah, kind of like you said, we didn't have a control study, and it was overall, 8 weeks is not a long time to really see significant change.
Yeah. So I think we need to swing this over to Tony for her. So if you have questions and we have time at the end, I'll hang on. But James, you have to return to class.
I do, but thank you, Brie.
Tony, you're still muted.
Thank you, Tess. Great. Okay. Hi, everyone. I'm Tony. I'm going to share my screen. And you're going to let me know, Tess, if that works? Why is it not full screen?
We're still seeing presenter view. I think if you go up to the top and give you viewing options.
Swap display. Look for that swap displays
There you
button.
go.
Oh,
There
thank you so much. There we go. Thank you so much. Great. See, you learn something new every time. All right. So I'm Tony. I also work here in Maine. Like Tess introduced, I have a small oyster farm and have grown some seaweed. Let me see, there we go. With my husband, who's a fisherman. So this was presentation that I did in Atlanta. We were talking about the learning objectives. It's just talking about, I think we're all pretty familiar at this point, some of the farm work that increases risk of musculoskeletal discomfort. We all have aging bodies. No matter where we are on that spectrum of age, we're all basically going in one direction, and being attentive to that, thinking about progressive limitations, but then also progressively being able to facilitate plasticity, right? We think of I think culturally we think, oh, I'm over the hill and I can't learn anything new. And that's just not true. We know neuroplasticity has room for us, as well as physical plasticity, to be able to adapt into a feeling of strength or mobility, depending on what we need. I talked about how movement and self-massage can improve flexibility, strength, balance, and increase productivity. And of course, that leads to wellness, as you can imagine, living with pain. And I think that's another cultural piece, but certainly we're dealing with a lot in the farming culture is, oh, I just have to push through. I have to get the job done. And some of what I think we neglect is our capacity to take care of ourselves. And so my role in helping sort of think about preventative and ways to make us all just feel more capable, comfortable, really. Sometimes the work itself is uncomfortable, but if we have ways to unwind some of that tension, we can see a longer trajectory for longevity on the farm. So this is Brie, actually, who you were just hearing from, showing Max Oliver, who is a 70-plus-year-old sternman, to his mother, who you'll meet a little bit later in the slides. So what leads to discomfort? Repetitive motion, right? We're always often doing repetitive gestures, right? There may be seasons of repetitive gestures, like to Brie's slide of sheep shearing, right? That doesn't happen all year long, but it has an intense period. So that could contribute to repetitive motion that needs like acute care or acute attention. Strenuous tasks, checking in with how much weight you're actually lifting, thinking about using mechanical advantage, thinking about, we talked about this in Atlanta, thinking about training to make a cushion between your maximum lift on a farm on the daily and what you can actually maximally lift is going to actually create a little bit of cushion for resilience. If I say, for example, I'm lifting 50 pounds daily for, a part of my season, oyster farming, for example, and then I go into a period where I stop lifting 50 pounds regularly. And then I expect my body, because it could before, jump back into that pattern without danger or risk. I'm mistaking the fact that I've adapted backwards. I've adapted away from the possibility of picking up 50 pounds over and over and over again. And so thinking about ways, those are other ways, that's like a strengthening practice to help someone build a cushion. So in that off season, I might consider lifting 100 pounds. So when I go back to my 50 pounds, I'm not at greater risk of injury. So this is something we're starting to talk about and look at. Sedentary activities, who's doing your books, who's minding the store, who's driving the truck or the tractor. A lot of these automated tasks, things are becoming more and more automated, which in one sense feels efficient and successful in many ways, but it can also detract from the human body's need to move and to have a broad range of movements. And so that can lead to discomfort because we're just not fully moving through ranges of motion. We're also potentially bracing. I know with some of the fishermen we work with, they might be driving, they might be at the helm and they're driving for hours on end, but they're not actually doing a lot of physical work, but their body is bracing against the movement of the vessel, the rock and roll of the ocean. They're going to end up with a kind of tension in their body that's not going to feel great at the end of the day. So aging, but essentially work and life, it's hard. And it has its drawbacks unless we break down some of the barriers. And I think one of the things that I see a lot of and try and overcome is this barrier through our visual signaling, right? We signal like, oh, well, yoga is just for the young soccer mom who doesn't have any other demands on her body or time. She can go and do these bendy pretzel things in a studio, but it's not really for me. But that's really not the origin of yoga, or the origin of yoga was designed to help master our minds and create sort of an optimal environment, our psychophysiological system. It was a caregiving practice, a self-caregiving practice. And why is that important? Because when we develop awareness about what's happening in our body, we can actually create change. We can have a sense of self-efficacy or a self-agency. And in that agency, or this sense of like, oh, my body's responding in this way because X, I know I can do Y, Z, Q, whatever your remedies are, to help unwind that stress or build up my resilience. And that's where I think we sadly, particularly in the working trades, the farmers, the fishermen, there are a number of people I've spoken to in the last 6 months who've said, oh, my husband works on trains. We need you. My husband works on an oil rig. He needs you. Like there's a lot of ways in which we're using our bodies still that would benefit, I think, from having some of these barriers to a studio sort of practice that would be really, really helpful to overcome. And of course, comfort returns us to a state of enjoyment, pleasure, productivity, and the sense of well-being. I'm going to breeze through this slide. I want to show you where I spend some of my time on a boat with oyster fishing gear. Through Fishability have done a series of little videos, but because I want you guys to move. So that's why we'll talk about flexibility, range of motion. And I've said some of these things already as we get going, but I'm going to show you my little friend, Charlotte, from Charlotte's Web. I had a pet spider in my studio last year. She moved in. She was really crazy and she was really sweet. And she lived in here for about 6 months. I gave her water on the regular, and it was just really fun to watch her. And one of my movement teachers talks about how, so a spider's web is a tensegrity structure, right? We are a biotensegrity structure, but a web is a tensegrity structure. And spiders actually can detect, like if somebody comes along and hits their web, they have a great deal of intelligence around what is it? Is it a fly? Is it a friend? Is it a foe? Do I need to flee? Through the quality of touch in the web. And I think this is something that we don't get taught as humans, but we have some capacity for in terms of refining our own sense of skill around, is the movement I'm doing good for me? Like, am I strong in this movement? Are my joints stable? Are all those little balance muscles working? Or do I have vertigo and I need some help because I'm feeling off balance? And then another movement teacher of mine talks about juice of the muscle and the pulp of the connective tissue, or the fascia, which is what surrounds our entire muscular system and connects to bones. This is another way of seeing it. Fascia is sort of like a very viscous web, but our arteries and our nerves. So you can imagine, right? Pain is often a nerve signal. It's a peripheral nerve signal to the brain that there's something encroaching on our system that's feeling threatened. But if you were somewhat constrained or restricted and holding on with your connective tissue because your muscles weren't moving through their full resilient range of motion, then you might start having signals from the nervous system that may or may not be an actual accurate temperature for what's going on, or barometer for what's going on in your body. So moving your fascia, getting that fascia moving in a lot of different directions can be really helpful for opening up the space around the nerves, potentially, right? This is not, I'm not being prescriptive here, but happy to talk about that later. So we're adaptive, right? We can adapt into pain. We can adapt into pushing through pain. We can also begin to adapt away from pain. But recognizing we are a biological structure, we're not a machine. And so I think sometimes we make analogies to machines and we try and treat the human body like a machine, but we're actually far more resilient. And I think that's something that's really important to keep in mind. We can adapt toward limited range of motion, pain, unhappy joints. And this is not to take away from anybody's experience of pain, but it's also to begin to give people a sense of like, oh, maybe there are breathing technologies, breathing paces, ways I could breathe that would help bring comfort to my body. There might be gentle movements. This is not suggesting everyone has to go out and be really vigorous. It's becoming friends with our physical structure and then learning how to adapt towards more comfort. So that could be movement, massage, breathing, really taking it in small adaptive pieces, gaining back some range of motion, easing anxiety, right? The nervous system is also, we're going to have a sense of anxiety if our nervous system is also in a state of fight or flight, right? Which can happen. We lose sleep. It impacts our relationships. It impacts our capacity to work. So massage can be something where someone else, much like Brie's great tool, is an external cue to the farmer to say, hey, where are you on that adaptive, where are you on that pain scale? They're starting to think about it. And if they're starting to think about it, then they're maybe starting to tune into, how do I feel? Oh, right, I don't feel so great. Or I can muddle through, or, oh, I need some help. We can begin making different choices. And I think it's helpful also to gain that same sense of, how do I feel in my body if I have released some tension, improved my proprioception, my sense of where I am in space. It can help with balance. We don't want to lose our balance as we age, but it does happen. Because here is Max's mom, Virginia. And she is 101 in this photograph, but I believe this is 2 years old. So we're calling her 103 these days. She's still fishing. And she's moving every day, doing something she really loves. And I think that's part of what we also want to impart is like giving folks the tools to understand that maybe they have some more self-efficacy in the process than they originally thought. And so what we've done is we've created on the farm and on boats, yoga stretches for farmers, yoga stretches for fishermen. We're working next on something for loggers to begin thinking about how to keep themselves moving during the day. On our website, I'm not going to stop because we're actually all going to get up and move here in a moment, or I will move and you will join me if you're willing. But I wanted you to be able to see how we have this set up on our website at Maine AgrAbility site. So we thought, well, let's talk about like, what's the work task? What's the repetitive motion somebody does every day? At the end of the day, Herman brings his boat in and he has to do this really awkward crawl between the hull and the side of the boathouse and to get his mooring up to get on the mooring, right? And if the wind is blowing, if there's a lot of chop, it's actually a really risky job. And it's always the same way because the boat's a fixed entity. He's always leaning out to the right. So could you start thinking about the patterns you regularly occupy and create the opposite shape? And so we also have a video demo for each of the 8 exercises. Then I do a short video clip. So that's all on our website that you can go and find through AgrAbility Fishing Resources. So rather than even do this recap, because I think you get the idea, I'm going to go through the 8 stretches on the poster. And I'm also going to show you a couple of tools, things that you might have around the house that you could use for some self-massage. So I'm going to stop my share. There's my husband doing a downward dog up against some lobster traps. So again, trying to also take this out of an enforced yoga studio space and bring it into where you are. And you're on the farm, so here you go. All right, we're gonna stop this share. And then, and I'm sorry, hang on. I can find my mouse, stop share. And I am now going to be here in my studio. If you are inclined to turn your video on just to be with me, you're welcome to. If you'd rather I not see you, but you want to move, I'm going to demonstrate those 8 postures and show you some tools. And then if we have a few moments for questions, great. Otherwise, at least you'll feel better going back into the workday. So first, we have cow pose. And you could do this also, like I thought about bringing a lobster trap in here, but maybe that wouldn't mean so much to you. So we're probably all in chairs, but you could do this sitting on a hay bale. You could do this sitting on the side of your truck. Like it doesn't have to be in a chair in a fixed space. It can be anywhere. So we're just going to take what's called a neutral spine, nice and tall. So I'm thinking about the crown of my head reaching away from my tailbone, and I'm forward in my chair, right? So if you're sitting back, maybe come forward to the front of your chair, letting your hands rest easy. And we're just going to take a breath in and just see what it's like to breathe. Sometimes letting the breath go with a sigh lets go of some nervous energy, which I might have, right? Now what we're going to do is we're actually going to lift the sternum just a little bit and lift your eyes just a little bit. And now we're going to take a couple of breaths here. I'm actually also going to push into the heel of my hands just a little bit. So if you can see, I'm creating a little bit of an arc or a pushing forward in my low back. So we're going to call this one cow. You could also do this on the floor. And often it gets paired with cat, which I'm going to show you next. So we're just hanging out here breathing. And then we're going to come back to neutral. So I'm just going to bring my eyes back to the horizon, my chin back to the horizon, let my sternum soften. Now I'm going to go to cat, and then I'll show you the two together. So coming back, I'm going to let my chin go towards my chest. My hands are holding onto my knees. My shoulders are wrapping forward, and I'm going to breathe into my back and let the breath go. And breathing in and let it go. And you'll have made all the proper adaptations, like if there's any reason your neck doesn't want to do either direction. Let's go between the two. So we're going to come up into cow. So breathing in nice and tall, looking up gently. And then exhale, let your spine come back into cat. Wrapping the shoulder blades around, letting the chin come towards the chest. And then inhaling to cow. And then exhaling back to cat. We're going to stay in cat. I'm going to show you just some little trick here. It's not a little trick, it's a preference of mine. In cat, I'm sorry, with the rounded back, go ahead and breathe into your back. And then exhale and come back to cow. Often it gets taught the first way. Sometimes it can be really nice to get a nice full breath into your back body and then let it go. From there, we're going to go into a twist. So I'm going to take my left hand to my right knee, and I'm going to bring I could just reach back and grab the back of the chair. We're still at the front of the chair. And just be really lovely with your spine, kind of twisting up, letting the crown of the head lift, reaching back with your eyes. And this is a seated twist. Letting the breath go, letting the hands go. We're going to come back around, taking the other way. So right hand to left knee, left hand reaches back. If you were super ambitious, super flexible, had a different chair height, you could bring your hand back over the back of the chair. I like to be gentle and remind people you want to use your muscles to do this, muscles through the waist, rather than pulling the bones with your hands. So you want to really try and make this work from your center. Breathing in and out. So this is seated twist on our fisherman poster. We actually have this, a friend of mine is in her truck, right? We do distribution. You may have, you may be a truck delivery person as well for your farm, or spend a lot of time driving to conferences and meetings, right? This is a really nice way, perhaps at the end of your drive, before you get out of the vehicle, or at the end of your conference, like moving, right? Getting that spine moving. We're going to come to standing. Let's do this. We're going to go to down dog. It's everybody's favorite. We're going to come around to the back of the chair. And I'm just walking my hips back away from the chair and letting the hinge come at the top of my thighs. So I'm not diving downward with my head. I'm reaching back with my tailbone. I'm letting my tailbone come back over the heels. And I'm going to just kind of check in. This is a place where we'd be listening to, like, how do I feel, right? I'm listening to my spine. I'm listening to the back of my legs. I could bend one knee and then the other, just kind of pedaling out the legs and see if, that might send a stretch up the side of my leg. Again, this is a nice way if you have an Apple Watch or something, and every now and then you get prompted to stand up, like go to the back of your chair and take a little down dog, or go to the side of your truck. Side of the truck is a great height. You could also, bonus, take a little push practice if that were interesting, right? And then a stretch. So we can also weave in more active movement and also just create time to breathe in passive places. Walking your feet back up slowly. Let's go ahead. You could keep one hand. Actually, I often teach it this way. I'm going to come behind the chair. I'm going to let my left hand slide across to the opposite side. My right arm comes up, and I'm just going to reach up and out and over. So I'm taking a long reach. It's lateral flexion of the spine, coming back up, changing sides, breathing in and up. Breathing out and over. I'm exaggerating, but you would not be remiss in exaggerating a sigh for yourselves, right? And do that one more time each side. Breathing in and up and out and over. So that's standing side bend. We could do, keeping with the theme of the chair. Again, you could use lots of other things. We're going to bring one foot up, take the hand across, let the opposite arm reach back. So this is much like how we were when we were seated, but now we're standing. For some folks, this is going to feel nicer for their spine. But if you're worried about stability and standing and balancing, you could do it in the chair, right? So it becomes adaptive to whoever we're working with, right? The yoga should meet the person, not make the person go out to some inaccessible place. And then the other side. Opposite hand, might sweep the arm, looking around. And again, using the muscles of the waist, right? Sometimes we'll see people try and crank into this shape using the force of their arm. Not really the point. But we're human, right? And we're always a little competitive. So we have to watch ourselves there. Good. And then coming back, we're going to take a tool. I grabbed my broom. I don't have my boat gaff here, but I have a broom in the studio. If this is accessible, right? This can be inaccessible if you have shoulder stress, right? Sorry, I put my chair. Now I want you to have my full view. I'm going to have to come out. I'm going to show you a variation for one arm. But if you have the range of motion, if you have a broom, you may not be somewhere where you have a broom, but you can see like this becomes a really nice way to get a shoulder stretch at the end of the day. You're also getting your back nice and long, nice and tall, opening the chest. For those of us without the broom, or that possibility, you could go to face a wall. Hoping you can see me. Bring your hand to the wall at 90 degrees, and then just walking your feet away from your hand, looking in the opposite direction. And this can be a big stretch across the chest, right? These muscles can get lovely and tight, as can the fascia, connective tissue. So you could do that. You can also take it up at an angle and then walk your feet away and get a really nice under the armpit stretch, relieving some of that tension. Last one is warrior one. So we're going to bring our feet parallel, step 1 foot back, and I just turn my heel in, my toes open, bring the arms high, reaching tall, take a breath. Bring the arms back down, take it on the other side, arms up. So I'm firm. I'm going to show you from the side. I'm firm in my stance. I'm reaching tall. I'm breathing. And coming down. I am going to show you, I know we have to stop. So some of you who were in Atlanta might have gotten a pinky ball from me, which is a nice hard rubber ball. They're pretty inexpensive, and I've found them at, like for $1 or $2, sometimes in places. Really nice self-massage tool. A TheraBand, any kind of resistance band. If you've been to PT, you've probably come home with one of these. I'm always happy to talk to people about how to use them, but they can be really lovely aids in creating mobility, but also a little bit of resistance, which sometimes gets that muscular contraction and lets fascia go. I see Tess. So I'll stop and let you take back over.
Thank you, Tony. And thank you, Brie and James, also for your presentations. At this point, I don't see any questions in the chat. If anyone has a question that they want to type in the chat quick, we can take a couple of questions. A couple of thanks, loved the stretches. An old tennis ball can be useful for self-massage. Anything unique for female frame versus male?
Oh, that's such a good question, and I would need another hour. But it is worth noticing. Like, I work with women oyster farmers, particularly on strength. They end up preferring to use much lighter gear. I'm gonna guess in farming there may be some places to think about that, but definitely then building the strength to keep yourselves out of risk.
There's a question, where do we find posters with yoga stretches?
So I think I saw a note. Brie said we may be able to send out interested staff some of our yoga for farmers and fishermen posters. So she put the number for Bella, the Maine AgrAbility project coordinator, at 207-778-4650. I am pretty sure we'd be happy if anybody wanted. Our favorite was, we found an oyster farmer had his up in his outhouse. We felt very proud of ourselves. We'd made it to the outhouse.
Very good.
They're
All right.
they're also online. So if you go to Maine AgrAbility's website, you should be able to print them out from there. But just contact Bella if you would like them. I think we might have some extra that we could ship out.
Yeah, they're lovely to have. You know, they're sort of this size. Yeah.
Thank you.
Yeah.
All right. Well, thank you again, all three of you, for a great presentation. And hopefully people will join us in March this year in Las Cruces, New Mexico for our 2025 NTW, and we'll have some more great sessions.
Thank you so much.
You're welcome. Have a great day, everyone.